Anyway, your name is Danielle Arnett. Can you briefly go over your kind of your career, your current credentials? What do you do?
Sure. I actually have two degrees from Ohio University, and my bachelor's degree, funny enough, is in exercise physiology, not what I do now. um, but the intention there was to help people be well. And so, upon finishing that, I obtained employment in the field of wellness. So, wellness programming and health coaching and um, at that time, upon obtaining employment, I also started a graduate program in counseling. So I did that immediately after my bachelor's degree. My master's degree is in counseling education from Ohio University. And I actually obtained a school counseling license first. And about halfway through my career, I did some school counseling work for a before and after care program in our local school district. And then about 4 years ago, I decided to really transition pretty much fully into mental health clinical counseling. So currently, I still help out with the school programming, but I do primarily clinical counseling for a private agency in our community.
Right. So, like, what title would we give that? Would that be like a clinician?
Yeah, I'm considered a licensed professional clinical counselor,
Okay.
so an LPCC.
And where are you based?
I'm in Logan, Ohio.
Okay. And like here, we're in Marion. Um, I'm
Okay.
I'm a Marion Technical College. I'm part-time
Yeah.
student. But anyways, we're mainly going to be talking about procrastination, which is part of the reason why I was interested in your credentials because you mentioned school counseling. I'm sure you run into that a lot, um,
Mhm.
especially with children. But I mean, even me, like I've been out of high school for almost 20 years. I'm still horrible with
Mhm.
it. I have my issues. I push things back all the time.
Mhm.
So, other than what I just said there, how would we define the behavior of procrastination? Just in
Yeah,
general, not just academics.
sure, sure. So really, procrastination is just the act of putting off tasks until the last minute or even past their deadline. It's really putting things off that does lead to negative consequences, even if the end result is okay. So it can be a time management issue or really difficulty with self-regulation, and it can be pretty minor and insignificant, or it can cause major issues.
I was gonna say, I think I can relate with that because part of my issue is not to get too much into my own personal stuff on
Hmm.
these questions, but like with me, I think throughout my school career, part of the reason why it never got corrected was because I
Hmm.
was the guy that would wait till the last minute to do his big term paper, and he still got an A and a B on it, so he
Yeah.
didn't I didn't care. Maybe
Yeah.
that was what was happening.
Hmm. Hmm.
So there's a bit of maybe there's not the right conditionings happening to make that
Sure.
correct that behavior.
Sure.
So we've just talked about behaviorally what is it. So what do we
Mhm.
think's typically happening on a cognitive level? Is it just about like pleasure centers and stuff like that?
Yeah, well, I think like most things, there are probably different reasons, a variety of reasons
Mm-hmm.
why it can happen. But I kind of broke it down. I was looking at your questions and trying to really put it into um, good words, words that
Mm-hmm.
would make sense. And from a cognitive standpoint, I think there's several reasons that people do this. One is I think sometimes we just simply overestimate how much time a task takes, or we might think we'll be more motivated later, and so therefore we're going to put it off until later, or how much time it will actually take to complete the task. But I also think, and I see this a lot in the field of counseling, some of it can come with like cognitive, what we call like cognitive distortions, meaning just kind of a little bit of a distorted view of things. Like for instance, I think they're the people. Sometimes people put it off because they like a little bit of defiance or rebellion, and it's their way of saying no one's going to make me do this when on their timeline. Or there's the person that's like the overdoer, meaning they've taken on too many things and they literally just have to get through the urgent stuff to get to that project, and then by the time that's done, they've procrastinated. Or we've got the perfectionists, the people who it has to be just right. So there takes a lot of time of mental planning. And then this isn't the perfect time to start, so I'm going to wait until then. And everything has to be lined up kind of right. And, we have the worrier. Sometimes anxiety causes us to put things off because we don't want to face them right in the here and now. So, and I think sometimes then there's people that are kind of, they have this idea, and sometimes they work better under pressure. They're maybe the more adventure seeking, risk taking people that get a little bit of a thrill out of putting things off and then having to do them in a limited amount of time.
You mind if I expand on one? You mentioned the perfectionist. That's one that I think I run into more a lot. Like, people used to say it about me, but I don't think it applies
Yeah.
as I've gotten older. I think part of it is when the perfectionism is it possibly one of the other reasons that they don't see themselves doing well, so they just say, I'm not going to do it.
Yeah, absolutely. And that kind of, in a way, ties in a little bit with anxiety, or,
Mhm.
um, even maybe a hint of obsessive compulsive. It has to be a certain way. And so just putting it off is easier than actually
And
having to do it and not doing it well.
um, not that I expect you to give away like all the keys of the kingdom because it's your job and it's how you make your living, but how would you recommend someone condition themselves away from this kind of behavior?
Yeah, that's a good question. I know that was one that was kind of touched upon in what you sent me, and I don't. This is a really loaded question, and it's
Yes.
not even that I mind giving away the keys to the kingdom, but it's. I'm gonna put it in simple terms, but I think it takes a lot more than just these simple things I'm gonna say, and part of it comes with. I really align oftentimes with a type of therapy called cognitive behavior therapy.
Hmm.
And it has to do with our thinking and our behaviors, and our behaviors and our thinking, and how they impact one another. And I think that's a lot of what we're dealing with here. But I want to first say, when it comes to that question specifically, that if it's resulting from maybe a mental health issue like depression, anxiety, ADHD, OCD, I think really that needs to be dealt with
Hmm.
maybe first. And kind of uncover that. But for someone, it's not always related to mental health
Hmm.
issue. Some people just procrastinate, and so things as simple as I need to make a to-do list. I need to put a SMART goal to it, meaning I have to identify actionable steps that I'm going to do, and kind of a timeline that I'm going to do. I think recognizing warning signs, awareness is like the first step of, hey, you know what? I procrastinate and it causes stress in other areas of my life. So, what is my plan for dealing with that? I think eliminating distraction. We have a very busy world, and sometimes prioritizing and eliminating some of the things that tend to distract us away. And also, I don't want to minimize. I think that we need to, and I don't mean this in a grand way, but we need to recognize and reward those small achievements that we make. When a task, we procrastinate sometimes just because the task is not fun. It's going to be big, it's going to take a long time. And if we can break it into small chunks and kind of celebrate our successes along the way, then we're better off toward that goal.
Well, I mean, talking about reward and like kind of
Hmm.
how would you schedule that would be another way, like reinforcement. Um,
Yeah.
so I guess in a way, just to simplify it, would it be easier to just this kind of more of a self-help thing, I guess, but would it be easier a lot of times to just or replace a bad habit with a good one? Is it
Yeah.
easier to coach it that way?
Yeah, absolutely.
Okay.
Yeah.
So that just put in perspective there.
Yeah.
Um, we talked about the negative consequences. What about the social aspect?
Yeah, procrastination.
Yes.
Yeah, I think that's when we know it's problematic. I mean, procrastination has a very negative connotation, and I understand that, but really it's not. If we procrastinate and there are no negative consequences from it, then is it really that bad? But what we see oftentimes with procrastination is the impact that it has on other factors. Like for instance, if you've ever worked with someone on a team that person procrastinates, it's frustrating, and so it can impact coworker relationships, peer relationships. It can frustrate, your partner or your children, whatever it is. I see that really by the time, and I know you're not asking necessarily from a counseling perspective, but by the time it's problematic enough to address it in counseling, we know that it's having a big impact on people's social, social wellness. And
Well,
so,
I mean, I do want it from your perspective, so that's kind of.
yeah, okay. Yeah.
That being said, I did have kind of a question. Like, what's the difference between like you're doing your cognitive behavioral therapy and then something like coaching? What's the distinction?
Yeah, you know what? Sometimes there's not a lot of difference between the two. Coaching is more, not, it's not more, but it's definitely goal centric and encouragement. And cognitive behavior therapy really is oftentimes used when the problem is more problematic or serious. We've got actually very distorted thinking that maybe it's not because of a diagnosis, but we have very distorted thinking about things. Or maybe I've got issues with obsessive compulsive behaviors, and so it's very much more focused on homework and knowing how the way we think ties to our behaviors. So you've got a little bit more clinical, maybe, approach to it.
Okay, so as far as developmental, you,
Mm-hmm.
you don't always necessarily work with somebody for an extended amount of time, but have you kind of seen kind of it get worse, I guess is a common question to ask. Have you seen it get worse versus get better?
Procrastination, like when
Yes.
working with someone, or
Yeah.
just in the um yeah, I mean, I think it can generally, when you're working with someone, they've made that first step of saying, hey, I want to work on this. So the ball's already in my court, and I'm already like, okay, we've started this process of contemplating it, at least. But the opposite can happen as well, and that really, it has somewhat to do with, well, it can do with a lot of things. First of all, I don't ever want to frustrate. You say developmentally, I have to be able to understand where someone is
Hmm.
cognitively, intellectually, to be able to know if I overwhelm them in the process of this, the likelihood that they're going to shut down and regress is probably much greater.
Okay. Yeah,
Um,
that's
yeah.
actually kind of where I was going.
Okay.
I was curious about that. I didn't elaborate exactly, but
That's
yeah, that's
okay.
exactly what I kind of meant because
Yeah.
I don't do it as much anymore. But like
Yeah.
at my job, I just work at Whirlpool. I work at a factory, right?
Okay.
I've done training for people and stuff like that, and I've seen
Yeah.
people that they don't want to do the work,
Yeah.
or
Yeah.
they'll quickly regress because that's part of it, the motivating factor, but
Yeah.
also just the conditions in the factory. It's not usually what people expect it to be. So when they
Yeah.
come in for their orientation, it's believe it sounds like I'm
Yeah.
exaggerating a bit, but I mean, I've had people that come in and think they're gonna sit down and push a button like they're George Jetson, and I'm
Yeah.
like, no, we're gonna be shooting some screws and
Yeah.
plugging in wires and stuff, and they don't understand that till they get there.
Yeah.
So it's hard
Yeah.
for them to want to learn, even if it's
Yeah,
just
and I
something
did
physical.
some of that, I put that in the just my brain puts it in the categories of developmental and also behavioral. So I had made a couple notes here, like sometimes procrastination is truly not caring if something does get done,
Hmm.
or or getting into bad habits for one reason. They get into they do something, they procrastinate, it turns out okay, so they repeat that behavior and it becomes a pattern. Or they delay one task in favor of another, and then that task gets put on the back burner. Or maybe sometimes people have trouble making decisions, or even from a more developmental aspect, they don't know or understand really what needs to be done, and how to do it. And maybe they don't know how to ask, or their tendency is just to shut down.
Yeah.
And I'm sure you see that a lot in your line of work when you're trying to train people.
Yeah, it's I mean, especially since it's loud, everyone has earplugs in and they can't always
Yeah.
hear. And
Yep.
um I mean, that's kind of beside the point, but it's, yeah, we have a lot of other distractions, other things going
Yeah.
on.
Yeah.
Um, you're,
Well, yeah. Go ahead.
oh, you're like wearing like weird things that you're not used to. Like you have earplugs in, you have safety glasses on,
Yep.
you have sleeves on, protective sleeves and gloves and
Mm-hmm.
steel
Mm-hmm.
toes. If you've never walked around, you're walking around on concrete.
Right.
So
Right.
all this stuff is going on at once, and then you got someone trying to talk you into this how you roll a
Yeah.
screw, and
Yep.
it
Yep.
sounds so mundane.
Well, and that's the thing. I love the theory of multiple intelligences, by Howard Gardner, because he talks about how people, not that I don't ever want to use this as an excuse or a crutch for not growing and doing better, but really we all have different types of intelligences, and some people can have the loud noise, and we also learn in different ways. So they can have the loud noise, the different stimulus, and they can still learn and train and that kind of thing. Other people don't do as well that way. That's not
Mhm.
to say that they're not intelligent or don't have good skills in other areas, but sometimes procrastination comes out because we're really working out of an area of weakness.
Mhm.
So, not that that excuses it, but it can explain it.
I mean, it kind of fit more sometimes with what we were talking about with anxiety, and then also
Yeah.
with the perfectionist angle. They just don't. They haven't worked on it. They don't want to work
Yes.
on it. They're not
Yes.
motivated to work on it.
Yep.
They might even be like with the anxiety angle. They might be readily,
Hmm.
avoidant to do that
Hmm.
in general.
Hmm. Yeah.
Um, Is there, I'm trying to think, is there anything else that you would like to specifically touch on that I did not in my kind of primer questions?
Um, no, I mean, I think that covered it. There were a couple other questions I think that you sent me. I don't know if we touched on them a little bit, but
Yeah,
I didn't.
I'm trying to think. Because with me, I think I would say I have a little bit of the issues with the social aspect procrastination,
Yep.
but we're not here to counsel me.
Yep.
um, the wife does get mad at me a bit. Um, Especially if I end up spending a whole day in here trying to do school assignments right now.
Mm-hmm.
Trying to think. Are there any? Okay, I have one now that I'm trying to think of. Are
Yeah.
there any other forms of therapy that you think should be used more often for this kind of thing? Like I'm kind of looking through your Psychology Today
Mm-hmm.
profile, and
Mm-hmm.
like some of them are more specific to like children.
Mm-hmm.
Like I think it's interesting with like play therapy. Like
Mm-hmm.
how would that factor into something like
Yeah.
this?
Yeah. Well, kids are different than adults in counseling, and what I find sometimes for kids, they don't have that full executive functioning
Hmm.
that is fully developed, and so what we do, their learning a lot comes through play, and so we might, I've got like a sandbox with little people in it, and we might act out some of the consequences of this,
Hmm.
or we might story tell about this. And some of those things, honestly, in all seriousness, work for adults too, depending on if they're like very visual learners
Hmm.
or storytellers.
I've just noticed a lot of that with they do it more for anxiety for stuff now with adults with
Yeah.
I, I don't, I kind of have a weird opinion on it with like coloring books and stuff. And like,
Yeah, yeah.
but at the same time, I can't say anything because I draw and I take stuff
Yeah.
with me and.
Yeah, and I look at that stuff more as tools. I
Mhm.
mean, those aren't, coloring in a coloring book isn't going to solve the anxiety issue, but it's a tool someone can use in the moment to avoid becoming overstimulated
Or
or
yeah.
to just, yeah. So, and I mentioned, I don't know what other ones you're looking at, but on my profile, but I trained in EMDR. Well, that one's not necessarily, that's an eye movement and desensitization. That's like trauma reprocessing.
Hmm.
And that, although that's not specific to procrastination, a question you had asked was, um, is it present? Is it often a sign of something larger?
Yeah.
And I'd say most of the time, procrastination isn't a sign of something bigger, but it can be. And so if someone's dealing with childhood trauma that is impacting their mental health, like depression,
Hmm.
anxiety, OCD, those are things that might take different types of therapies. I think CBT, in my opinion, fits very well for someone working on procrastination specifically. But if it's tied to a bigger issue, then we might use other forms of therapy alongside that.
Yeah. And then I also saw like uh, compassion focused like
Yeah,
therapy stuff like that.
yeah,
That seemed to fit a little bit, but
yeah.
kind of like with my training
Hmm.
example, there are some people you can't really go that route with
Yeah.
and go anywhere. It's kind of weird how that works.
Yep.
Um, let's see.
I do think to kind of add to that, that's why a lot of clinicians today would consider themselves eclectic. They have an
Mm,
eclectic because, I don't think compassion focused therapy, um, I love the elements of it, but to exclude elements of other therapies would be, in my opinion, doing a disservice to a lot of clients. So, really, it's just good to know lots of different kinds of therapies and use them when they specifically deal with what is needed.
mm-hmm. um, like I keep pulling from my training
Yeah,
experience because
yeah,
it's not the
that's good.
same, but there's some overlap because
Oh, sure.
I'm obviously not a licensed clinician or anything like that. I just used to train people, and the other difference was that is I might have a group of 9 people, and I'm supposed to
Yeah,
attend to all of them at the
yeah,
same time.
yep,
So I'm a little bit stretched thin. So a lot of it, well, a lot of what we're describing kind of would explain like a lot of the different techniques I would use all at once between different
yeah,
people.
yeah,
And it's
yeah.
kind of funny how that works. That in your case, you might be counseling or coaching with one individual, and it's a
Hmm.
little more of a targeted response as
Yep.
opposed to I'm stretched in 3 different directions.
Right. Yeah. And I think that's why, I'm a big believer in when they're used well in employee assistance programs.
Hmm.
Because listen, people's habits and their mental health affect their work and how they work. And so sometimes it's disruptive enough that it's beneficial for an employer to say, hey, I think you could use a little bit more training in this area,
Hmm.
and a therapist could actually get more focused and specific with you versus me just doing the general training.
Hmm. Um, so I'm trying to think if there's anything else I want to go over. Oh, this might be just a little one.
Hmm.
Just kind of the use of different terms. I was trying to figure out, like, when we talk about depression and anxiety disorders and all these other things in relation to the behavior, would we.
Hmm.
There seemed to be a bit of a debate when I was trying to look up things. Would we consider the depression, would we call that like an underlying condition? Or does that not apply? Does that term not apply?
Well, yeah, no, I think it applies, and I think maybe what you're seeing is is it can be an underlying condition. So, when counseling, what we like to do or tend to do is we determine what is the primary
Mm-hmm.
problem. here. Okay, so maybe someone has had a death in the family, or maybe someone has had work issues, or and so we identify what is the primary mental health
Yeah.
diagnosis. But there might be other things that are contributing to that, or maybe they're like provisional diagnoses where we're like, this person has depressive symptoms, but depression isn't their main issue
Hmm.
that we're dealing with. And then we try to attack it from, okay, what's the biggest, and then kind of down to that. So I think it can be an underlying issue, or I think it can be a primary
Yeah.
issue. Yeah.
Part of it's because when I was looking at it, I was like trying to type up things, and I used that term, and I'm like, I don't think it fits, because every time I
Yeah.
looked into it, they mentioned things like diabetes and physical
Yeah.
conditions.
Yeah.
But
Yeah.
I'm sitting here and I'm like, well, if your depression is caused by chemical imbalance, maybe that can
Yeah.
it
Yeah.
applies.
Well, and we use a treatment manual called the DSM-5,
Hmm.
and it does require us to specify. So it could be medically induced depression,
Yeah.
or it could be depressive symptoms, with that are mild or moderate. So we have to recognize as clinicians, is this the primary issue, or is this an underlying issue?
Okay. Um, no, I think that kind of covers everything that I wanted to get into. I know I didn't want to take a lot of your time, but I
No.
do appreciate that you got back with me and we got this to happen, because I was actually trying not to procrastinate for once. I actually got this done in time. So
Good
I
job.
thank you for joining me today. And
Yeah.
well, I mean, I probably won't bother you too much, but it's nice talking to you.
Yeah, thank you. You too. If you have any other questions, don't hesitate to follow up.
All right, thank you.
All right. Bye-bye.